and headquartered in Telangana, India, SCRMP is a dedicated society working to advance clinical research and support healthcare professionals. Through initiatives like workshops, webinars, and our publication Health Kingdom, SCRMP empowers professionals by fostering innovation, collaboration, and education in the field of clinical research. We are also excited to share that SCRMP will soon be registering internationally, expanding our reach and impact beyond national borders. We encourage all attendees to explore our membership options, which include exclusive benefits such as access to internships, educational resources, networking opportunities, and much more. Being part of SCRMP is a step towards enhancing your professional journey and contributing to global vision for better healthcare. Now, it is my privilege to introduce today's esteemed speaker, Ms. Salomea ma'am. She is a public health expert and epidemiologist with a master's in public health and is currently a PhD candidate in public health and epidemiology. She is the founder of Public Health Consultancy Hub Georgia, an initiative dedicated to mentoring future public health professionals, supporting research development and strengthening health systems. At present, she works in the World Health Organization 𝗴𝗵𝗶 country office in Georgia, where her work focuses on disability, rehabilitation, and assistive technology, with an emphasis on equitable access and inclusive health policies. Her doctoral research explores the intersection of thyroid cancer and reproductive health. Her broader interests include cancer policy, locally driven capacity building, and the advancements of equitable care models in low and middle income countries. Additionally, she holds an IELTS certification with a score of 7.5. Her core competencies include research, data analysis, project management, advocacy, and communication. Without any further ado, please join me in welcoming Ms. Salomea ma'am. Over to you, ma'am.
Thank you very much for the introduction, and thank you very much for hosting me today at this webinar. Specialized care compared to 7.1% in the control group. We also observed a higher rate of low birth weight, with the WHO definition, of course, in the newborns which were delivered from women which underwent the thyroid cancer treatment. So, also to share the findings on the next slide, please, some of the findings. Yes, so while this study revealed the increased risk of miscarriage and neonatal complications among thyroid cancer survivors, another critical aspect we examined was abortion rates and maternal health complications. Understanding whether thyroid cancer treatment or hormonal changes contribute to these risks is essential for improving reproductive health care, of course. So beyond pregnancy outcomes, as I've mentioned, we also examined abortion rates and maternal health complications, and I would like to share with you the abortion rates, which were quite significant. We also examined it based on the age group and also based on the treatment type, and now I will share with you the results. So 47% of women with thyroid cancer experience continuous abortions versus 30% of women without thyroid cancer. So you can see that it's quite significant difference between these two groups. The age distribution analysis showed that among women without thyroid cancer, the highest proportion of abortions, 29%, occurred in the age group which was from 35 to 39, whereas in women with thyroid cancer, this highest proportion, 33%, was observed in the age group of 30 to 34. So, which means that the abortion rates in the thyroid cancer were in the younger age group compared it to the women without thyroid cancer. Among women with thyroid cancer and a history of spontaneous abortion, 69% had undergone surgical treatment prior to pregnancy, while 20% had received radioiodine therapy. Among those with a history of surgical treatment, the highest proportion of spontaneous abortion was 47% occurred when conception took place within 12 to 16 months after surgery. Among women with a history of radioiodine therapy, 69% of spontaneous abortions occurred when the interval between treatment and pregnancy was no longer than 12 months. And I would like to add here that when women are undergoing the thyroid cancer treatment, it is not recommended to plan a pregnancy within 12 months. So these results might also be entitled to that recommendations. So now I would like to move and to share the next slide, please, because we've been speaking about the benefits and the good side of the working with the registries, and I would like to touch the challenges which occur while working with the registries. So while registry-based research provides invaluable evidence, working with large-scale health registries comes with significant challenges, of course. Issues like such as the data quality, the missing records, the outdated technology, the integration difficulties can affect the accuracy and completeness of the findings, of course. So registry-based research is a powerful tool, but it's not without challenges, of course. One major issue is data quality and completeness. Incomplete patient records, missing pregnancy outcomes, or inconsistent documentation can make it difficult to conduct reliable analysis. Without high-quality data, our findings may not accurately reflect the real-world trends. Another challenge while working with the large-scale registries is outdated technology and the infrastructures. Many health registries still rely on old software systems, for example, which makes the data extraction, linkage, and analysis of the data very time-consuming. For example, in Georgia, for the cancer registries face challenges such as the lack of trained personnel, outdated IT system, delays in data reporting. These issues impact the efficiency, of course, and the accuracy of the real-world data research. I would say, like, additionally, the lack of the integrating data from multiple sources, such as cancer registries, birth registries, and the hospital databases, requires standardization and coordination between institutions to make them to speak in the same language. And without proper integration, we risk missing key connections between thyroid cancer history and pregnancy outcomes. And we should always think about addressing these challenges, because it is essential to improving real-world evidence research. Investing in better data collection, IT infrastructure, and standardized reporting will enhance the quality of insight we can generate. Next slide, please. Thank you. So before we finalize the presentation, of course, I would like to speak from the WHO's perspective as well, to really understand how real-world data and real-world evidence are being used globally. It is important, of course, to look at the role of World Health Organization plays in all of this. The WHO is not only focused on the collecting data. It's working to build a stronger digital health system where the data we gather is very accurate, used responsibly, and actually helps to guide real decisions at every level of healthcare. So one of the key efforts is the Global Strategy on Digital Health, which is running from 2020 to 2025. Now, this is a strategy which helps countries build the tools and systems they need to collect and use real-world data in smarter, more connected ways. The idea is that good digital health systems and solid data are essential if we want to reach goals like universal health coverage and long-term sustainability. Another example is the WHO Global Health Observatory. Think of it as a global health dashboard. It brings together data on everything from disease to healthcare resources, and researchers, decision makers, and the founders use it to plan programs and decide where to invest or improve services. And of course, I would like to highlight the ICD-11, the tool. This is a tool where the WHO helps us to make sure that we are all speaking the same data language. The ICD-11, which is the International Classification of Diseases, allow health professionals and researchers across different countries to compare the data and the studies more easily, especially when working with the registries. The heart of all it, the WHO's goal is to create global environment where real-world insights actually lead to better care, stronger system, and smart data-driven policies. And I have a quote here from the WHO's Director General, Dr. Tedros. Harnessing real-world evidence is central to designing equitable. So I would strongly recommend that if you have any possibility to join WHO, I would strongly encourage you to do that.
Thank you, ma'am. The next question is, what are the current best practices for ensuring the validity and reliability of data from pharmacy dispensing software when it's used as real-world data?
The current best practice for ensuring the validity and reliability of data from pharmacy dispensing software when it's used as real-world data. That's a very interesting question. So I would highlight maybe several points. First of all, the data source understanding and documentation. You should know the software and architecture and the workflows to understand how the pharmacy software captures codes and stores dispensing events. I would also maybe say the data standardization and decoding. It is really important to use standard technologies. So, for example, while mapping the drug names, doses, and the roads. So just to use the standard terminology, which then makes it more harmonized. Additionally, I would also say the data quality assessment, for example, which I will also highlighted in my presentation, but not in the link with the drug. But I would say that the same, that the data quality is quite important. Maybe the validation against external sources. So I would highlight maybe just these points which comes to my mind right now.
Okay, ma'am, thank you. So we have another question. Can pharmacy students or practitioners access any open real-world databases to practice or learn analytics? If yes, could you suggest a few platforms?
Yes, of course, you can access, and the first that comes to my mind is the FDA adverse event reporting systems, and you can easily access the reports there. Also, you can search for Open FDA. This is an open access, and it includes the data like the drug labeling, adverse events, recalls, and enforcements. I have also some resources from UK when I was presenting there this presentation on the real world data and evidence. I don't recall the exact name, but you can search like the UK clinical practice research, which is an open access to real world primary care data, including the prescriptions. And also from UK, I recall the open prescription. This is open data on NHS prescription and dispensing volumes in the UK. But of course, like I would strongly encourage you to search for the FDA, like Open FDA, when you can have access to the data.